Okay, it's just me and you. Okay, so this is when we got Jenny here. Hi, Jenny.
Hi, Dr. Gilmore.
And you remember this patient, right?
Yes, sir.
And you were the one with the camera. We've changed the way we do our cameras now, right?
Yes, sir.
Well, that's so. We were just learning back then. This is all the way from 2005. And those are your hands right there. So
with the purple gloves.
with the purple gloves. So you remember this? Could you
Yes.
believe what we finally got out of this ear?
Yes, I sure did. This was like amazing.
It was pretty amazing. Okay, so at this point, one of the things we didn't do, we didn't give our patient a nickname, which we do now. The other thing was we used just a portable phone to video, which now we try to use something with a tripod. Okay, so here I'm using the alcohol to get ready, and you're going to use the cold spray. And some of this gets off camera here in a second, but again, your job was to take care of the patient, right?
Yes, sir.
That's right, not so much to worry about whether we were on camera or not. There you go. So now you can see we're injecting the anesthetic here. Mm-hmm. So what did you think? I've had some people ask, well, why can't you use epinephrine? I had a number of people ask me that. And the reason you can't use epinephrine in the ear is because it can cause profound vasoconstriction and it can lead to some necrosis and sloughing of the tissue, and we don't want that. Yeah, and so here we are, about to make the first incision, and I could have, in retrospect, I could have made this incision from the back of the ear. I don't think it would have mattered, though.
I don't think it would matter either.
Yeah, and because...
Now it's not pouring out.
Yeah,
Yes.
this was fairly impressive.
Bringing back all that memory, yes.
And I've had some people say, okay, as you're doing this, you should have probed the ear. They wanted me to put something, actually some kind of blunt object into the ear to probe around to make sure there were no loculations. But what I think people don't realize is that I could actually feel the earlobe, and I could feel the fact.
Right.
Yeah, and in a few minutes you'll see I really, I push again, and I felt kind of a little pop. I don't think that's it. It may be coming up here in just a moment. But I feel a little pop, and I knew that one of the loculations had opened up again, and we got quite a bit more pus that had come out.
Mm-hmm. Keep coming.
Yeah, I expected this to be, large and be painful and all that. It turned out he didn't have that much pain at all.
Not at all.
But then every time I pressed on it, I kept getting more and more pus out. It was really fascinating. I think right there.
Right there.
Yeah.
Yes.
I could tell. I felt like one of those loculations or walled off areas had actually broken open.
Yes.
And then you can see a lot more pus and blood and everything comes out. And then I got concerned, okay, well, there might be more of these little loculations, and that's why I come back now with the scalpel and say, okay, let's go ahead and just make another just a straight stab incision to see what else might be in there. And of course we gave him instructions to come back the next day. We really wanted to follow up on this because I was concerned because of the size of this and the fact that it was on the ear, that this could recur, right?
That's right.
But he didn't come back, which was really kind of interesting. He did not follow up with this. He did take his medicines though, and when he came back, I could not tell which ear had been the one.
Wow, that we worked on.
Because it had healed so well.
Beautiful.
I think this is just about the point where we were done.
Almost.
So would you have done anything different from a nursing standpoint? What would you have done differently? Anything?
No, sir.
I think you did a fantastic job, in fact.
Thank you.
I really do. You were right there. You gave me everything I needed. And you still made a darn good video, even though we were just really rookies in making these videos. You did a terrific job.
And I did hold the camera / phone in one hand.
Yeah.
Yes, and worked helping you out with my other hand. Wow.
That's right.
We are a good team.
Yeah, well, I think we're a good team too. And how did you dress this? Do you remember? Did you just tape a gauze over it?
I believe so. Yes, sir.
Just a gauze, and I think that's all it needed.
Yes.
Oh, that was fun. Thanks, Jenny.
You're welcome, Dr. Gilmore.
Action.
Stay tuned for the Meta 7 video.
You're live. I don't want you to make anything up. I want you to be completely honest. Tell us about your experience with Meta 7. Go.
I started taking it, and you said it could take a little while for the effects to take in, but immediately I felt so much energy the first week. I was so excited about it.
Awesome. How about beyond the first week?
I still feel like it. I probably didn't start taking it till like the week after Valentine's Day.
Okay.
And it was right during the competition time, and I was real sluggish and stuff, and it immediately helped.
Wow, that's fantastic. So you feel more alert?
I do.
And do you get jittery, shaky kind of feelings with it or anything like that?
No, not at all.
Okay.
And with some vitamins, I do.
Uh-huh.
I actually take like a children's vitamin because, and when I ask you about it, because I'm not real good with a lot of vitamins, but I had no problems at all with it.
Wonderful. So it was a good add-on for you, gave you lots of energy.
Yeah, it was great.
Well, wonderful. Thanks a lot.
You're welcome.